Greetings. Today I'm going to talk about peptides and bioregulators for heart and cardiovascular health. The heart and cardiovascular system are vital for overall health, delivering oxygen and nutrients throughout the body. Maintaining cardiovascular health is crucial for longevity and vitality, and emerging research highlights the potential of peptides and bioregulators in supporting heart function and vascular health. This video explains how these compounds may benefit the cardiovascular system and important considerations for their use. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.Health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to help each other. That's why he is using this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. What are peptides? Peptides are short chains of amino acids that act as signaling molecules in the body, influencing processes like tissue repair, hormone regulation, and inflammation control. Their small size allows them to interact with specific receptors, making them effective for targeted health interventions, including cardiovascular support. What are bioregulators? Peptide bioregulators are naturally derived peptides, typically extracted from animal tissues, designed to regulate and optimize the function of specific organs or systems. For the cardiovascular system, bioregulators may enhance heart muscle function, improve blood vessel health, and support overall circulatory efficiency. How peptides and bioregulators support cardiovascular health. Peptides and bioregulators may contribute to heart and vascular health through several mechanisms. Promoting tissue repair. Peptides like BPC-157 are known for their regenerative properties, potentially aiding in the repair of damaged heart tissue or blood vessels, which is critical after cardiovascular stress or injury. Reducing inflammation. Chronic inflammation contributes to cardiovascular diseases like atherosclerosis. Peptides such as thymosin alpha-1 and KPV, as well as bioregulators targeting the vascular system, may reduce systemic inflammation, protecting blood vessels and the heart. Improving blood flow. Certain peptides like TB500 enhance angiogenesis, the formation of new blood vessels, and improve circulation, ensuring better oxygen and nutrient delivery to the heart and other tissues. Supporting heart muscle function. Bioregulators like those derived from heart tissue, e.g. cardiogen, may optimize cardiac cell function, improving the heart's pumping efficiency and resilience under stress. Regulating blood pressure. Some peptides influence the renin-angiotensin-aldosterone system, which controls blood pressure. By promoting vascular relaxation, they may help maintain healthy blood pressure levels. Enhancing antioxidant defenses. Oxidative stress damages the cardiovascular system over time. Certain peptides and bioregulators may boost antioxidant activity, protecting heart and vessel cells from free radical damage. Popular peptides and bioregulators for cardiovascular health. Several peptides and bioregulators are associated with supporting heart and vascular function. BPC-157. Known for its tissue healing properties, it may support recovery of heart and vascular tissues, reducing inflammation and promoting repair. TB500 enhances angiogenesis and reduces inflammation, potentially improving blood flow and vascular health. Thymosin alpha-1 supports immune function and reduces systemic inflammation, which may benefit cardiovascular health. KPV inhibits pro-inflammatory cytokines, e.g. IL-6, TNF-A, enhances tissue repair, and modulates immune responses via melanocortin receptors. Benefits include inflammation reduction, gut health, let's not forget the strong gut-brain relationship, and wound healing. Cardiogen, a bioregulator specifically designed to optimize heart tissue function, potentially improving cardiac performance and resiliency. GHKQ, a copper-binding peptide that supports vascular health by promoting collagen synthesis and reducing oxidative stress. Considerations for using peptides and bioregulators. While peptides and bioregulators show promise for cardiovascular health, several factors should be considered. Quality and sourcing. The purity and quality of peptides vary widely. Source products from reputable suppliers to ensure safety and efficacy. Professional guidance. Consult a cardiologist or healthcare provider before using peptides or bioregulators, especially if you have pre-existing heart conditions or are on medications. Holistic approach. Peptides and bioregulators are not a substitute for a heart-healthy lifestyle. Combine their use with a balanced diet, regular exercise, stress management, and smoking cessation for optimal results. Potential side effects. Some peptides may cause mild side effects like injection site irritation or fatigue. Monitor your body's response and discontinue use if adverse effects occur. Regulatory status. Many peptides are considered experimental and may not be approved for cardiovascular use by regulatory bodies like the FDA. Verify local regulations and ensure compliance. Ethical use. In competitive sports or regulated environments, check for restrictions, as some peptides may be banned by organizations like the World Anti-Doping Agency, WADA. Natural strategies for cardiovascular health. For those hesitant to use peptides or bioregulators, natural approaches can also support heart and vascular health. Nutrition. Follow a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, e.g. omega-3s from fish or flaxseed. Limit processed foods, trans fats, and sodium. Exercise. Regular aerobic exercise, e.g. brisk walking, cycling, and strength training to improve heart function and circulation. Stress management. Practices like meditation, yoga, or deep breathing can reduce stress hormones that strain the cardiovascular system. Sleep. Prioritize 7 to 9 hours of quality sleep to support heart recovery and regulate blood pressure. Supplements. Consider evidence-based options like omega-3 fatty acids, coenzyme Q10, magnesium, and B-complex, see our Mito Energy product, to support cardiovascular function. Additionally, Endocalix Pro has been shown to help repair and restore the glycocalyx that protects the inside of our blood vessels. Last, but certainly not least, exercise with oxygen therapy is perhaps the most significant thing a person can do to enhance their overall vascular function. It is the only thing ever documented to open and reset the microvascular system to youthful levels. Conclusion. Peptides and bioregulators offer promising potential for supporting heart and cardiovascular health by promoting tissue repair, reducing inflammation, and improving circulation. While research continues to explore their benefits, these compounds should be used cautiously with high-quality sources and professional guidance. Combining peptides or bioregulators with a heart-healthy lifestyle, rich in nutrition, exercise, and stress management, can optimize cardiovascular function and promote long-term vitality. Always prioritize safety and informed decision-making when exploring these tools for heart health. As always, please reach out for information on our personalized health enhancement and age reversal programs, including bioidentical hormone replacement and peptides, 941-806-5511.